I'm not
Right.
very much, accomplished with this one. So let me introduce you to our audience, because you
Sure.
are very accomplished, and you don't look that age to have gone through so much. What's your age, by
Thank you
the way,
so much.
if it's okay? Can you share with us what's your
Yeah,
age?
sure. I just turned 30. Yeah.
Wow. Wow. 30 and an accomplished lady. Okay, let me tell you guys what she's accomplished in. She's the founder and CEO of National Autism Research Center in Pakistan, which is an organization that provides free autism resources. She's also a medical doctor, a clinical psychologist, and a behavior therapist. She has been a TEDx talk speaker in 2022. Oh my God. TEDx is actually in one of my bucket list as well. And I am going to be get coaching from you, girl. Okay. All right.
I'm sure you will. I'm sure that's gonna
Mashallah.
happen really soon.
Mashallah.
Inshallah.
Inshallah. Inshallah. So you have also got a lot of certifications and alumni association with UNICEF, with Harvard, with Stanford, with London. My goodness. Mashallah. Mashallah. So you are definitely more than the expert to be talking about all of the stuff that we're going to be talking today. Okay. So my first question for you is, what brings you to the autism spectrum community?
Right. Okay, first of all, I'd really like to thank you for giving me this opportunity because I think it's the wider the audience can reach, I think that is more important because people are listening about autism, but they're not really aware of, where they can reach out, where they can find reliable resources. I mean, there's so much going on the internet, but not every resource that is provided is reliable and authentic. And this kind of relates to your question that what brings me to the autism community. And so I mentioned briefly about this in my TED talk as well. Like there's a history behind it. There used to be a kid where I was living who had all these symptoms, but he was not diagnosed. And the parents would keep their child chained, and that was a horrible sight for all of us to watch as we were growing up. He would be just sitting at the stairs all the time, and his hands will be chained, like we don't even keep animals like that. But it was an unfortunate sight for me. And after I finished my med school, I wanted to change my career path towards psychology. And that's when I thought, that thought kept in my head, like it just kept coming back to me about that child, that what if he can get the diagnosis earlier? How his life, his family's life, they could have changed a lot. So that's what motivated me to, become an active advocate for autism, and I started to do medical research on it.
Mhm.
I originally come from Pakistan, and in Pakistan, unfortunately, the conditions, the facilities available for autism are next to none, which is a very, very sad situation. So I started to do more research about it, and the more I got involved, the more passionate I felt about it. So, yeah, to sum it up, that's how it is.
Mashallah, mashallah. That's a real heart-touching talk, because for me it was because of my son, and then I am a
Yeah,
neurodiverse myself. I have had a lot of struggle growing up, and then I was abused, I was traumatized, and beaten a lot, because people won't understand me. I wouldn't understand commands, and they would think that I'm just being retarded. And then for some reason, Asian parents, South Asian parents, they think like beating, physically pushing the child will somehow,
yeah.
you know
Do
repattern
some
the brain.
miracle to fix it. Yeah, yeah,
Exactly. Okay, so since we both have a very common love for the mom psychological and emotional support, so I want
right.
you to talk about it, give our audiences some really great strategies that they can implement in their daily life, as the way that they show up for themselves and their child affects their child as well, right? So give us some really awesome tips that we can start implementing right away to change our life.
I hope it helps. I'm just going to briefly first talk about the importance why we are talking about this today. You know,
Yeah,
most of the
sure.
time the focus is all about taking care of the child. What can you do to improve their health and everything, which is absolutely essential. And we are going to talk about it today as well. But as you mentioned, Dr. T, that the health of the parents, their psychological well-being is also really, really crucial. That is actually the topic that I'm currently working on the psychological well-being of the mothers, especially because they are the caregivers. They spend the most time with the child. I mean, the fathers are definitely doing a lot of work too, but in particularly Asian societies and all over the world, as we have seen in previous studies, that mothers are the ones spending more time with their child. So it's really important for them to take care of their own health too. I mean, when I started to research about it, I figured out that most of the mothers were either severely depressed or on the verge of suicide. Can you believe that? And
Yeah,
that was
I have been
I
there.
was really,
I've been there.
really sorry. Yeah, it's really unfortunate. And the reason for that is that because these mothers are not getting any help, or they're not even looking for it. Their whole focus is on their child. So
Yeah.
you need to like keep in mind that you can't keep filling from an empty cup. The cup needs to be full itself first to give it to others. So it's
Mhm.
extremely crucial to, talk about and to focus on the health of the parents too.
Definitely.
So yeah, yeah. So yeah, when we talk about the health of the mothers, and this is why I started to take more, certifications. I became certified in cognitive behavioral therapy to help out the mothers. Now, usually we don't use CBT too much for the children who have autism. Definitely, it helps with anxiety and some other correlated comorbidities and issues. But
Mhm.
particularly, this was to help out the parents because they're dealing with a lot. So yeah, first and foremost is that, you can look for a purpose. You need to figure out that, there is something going on with me and I need help for that. There's no shame in asking about it. And you need to just realize this, that you can't keep giving to everyone without taking care of yourself too. That's the first thing. Then I will continue to talk about it. If you have any question, I think I've been talking too long. If you
Yeah,
could
yeah,
just,
yeah,
ask ahead,
definitely.
then I will. Yeah,
Definitely.
then I can
Because,
add more to it.
yeah, sure. So far you have said that the first step that we should be doing is to understand that everything happens to us for a reason, for a purpose. And we have had a lot of already, comments from our mothers
Yeah,
become the primary caretaker automatically. Yes, because first of all, it's we are mothers. We have given birth to them. We understand them more than anyone else understands. And then
that's true.
the other part is, when you have a special need child, it suddenly becomes like you are also trying to survive with your child, and the world is trying to push you out, like kick you out, like I don't really know who you are, you don't care, and the mother is trying to fight for not just her child but for herself. And then yes, I totally understand, because I have been there, the suicidal mom who was clinically under high alert. My husband had to have two separate CC camera at home so that he could monitor me, because I was either I want to kill myself or I want to just leave, because this was over. I had my
Yeah,
own
it's
issues and
overwhelming.
then other issues as well. Exactly.
Hmm.
So the first step that we have to do is understand that it's very, very crucial and important for us to be stable as well, if not more, because it's from me that the other stuff will come out. The mindset piece, which, if I'm not sure whether you are very accustomed with me as well, because we have been talking just for a few days, right? So for me and the work that I am doing, a major part of it is on the mother mindset. I work a lot on the mindset. I teach my students a lot on how to take care of themselves, not just the bubble bath skincare kind of way, but the real way. Because when you
Psychological health, which is the most important,
psychological health,
actually.
exactly,
Yeah.
exactly. YouTube has been really nice, but then it has become this trend of the it girl and the self-care girl. Self-care means just the taking care of your body, I guess, or something like that. But to me, as a special needs mom, the self-care is even more deeper, because you need to find your why, like you said. You need to find your why you want to move forward, why you want to have that strength to be able to push through. Because me, I personally don't, I personally don't feel like there should be a push through, right? Things should be as easy as possible. We need to be able to understand our needs and communicate those needs with others. So in that sense, I want you to also guide us. Let's say a mom is struggling at this moment. Many of our clients and students and audiences are here currently struggling.
Yeah.
What would be those 5 steps that you can teach us to, flip the switch? Let's say I'm exhausted, I want to kill myself. What will be those 5 simple steps that I can flip the switch and be like, okay, I'm okay?
Right. Okay, well, that's really a very, I think, a very effective thing that we can do. But here's one thing everyone needs to understand. First of all, nothing would work in a single day. It's not like magic, that you step 1, 2, 3, 4, 5, and then boom, suddenly you're feeling perfectly fine. But yes, these do help. So, the things that I'm going to share will definitely help, but you need to work on yourself every day. No, you can't have the fruit without putting the seed, pouring water into it, cutting out the weeds. That does not happen in a day. It takes time. But yes, there are definitely some steps. Like, first of all, like I said about CBT, someone also asked in the comments that can you tell like how it can help adults with autism. We'll get into that. We haven't ignored it. Okay, so first let's look step by step into what you can do when you're feeling suddenly overwhelmed. See, the most important thing is you can't heal something until you cut off from the source of injury. Okay, now this is important to understand because in this situation, the source of the injury is actually our own child, our family. We can't cut off from them 100%. But what you can do is you can cut off from that situation. So the moment that you're feeling completely overwhelmed, this is why social support, family support is very important. That's when it comes in. If you have a friend, if you have anybody at home in that situation, wherever you are, ask them to replace you for that moment. Let's say you were sitting in your living room and your child is having a meltdown. And that is the moment you start to feel overwhelmed. But you're trying to deal with it. You're still trying. In your head, you're thinking, I want to kill myself. I'm done with this. But at the same time, you're completely trying to stay calm on the outside. You're like, it's okay. It's going to be fine. I got it. So don't do that to yourself. You're hurting. You need to stop at that moment. Ask anybody that you can rely on. Of course, not everybody has someone like that, but this is why it's important too, to find a social support group. In the end, I will definitely refer like some things about that as well. So just ask somebody to be there instead of you to cut off from the source of the overwhelm, right? And find yourself a quiet corner. Again, just for 5 minutes, 10 minutes, that's all we are asking here, right? Not to completely cut off from your family. Okay, once you're there in a quiet corner, it's a very simple thing which everyone keeps saying about. Take a deep breath. I know it sounds like, yeah, that doesn't really do anything. What is this? But it does. What happens is it helps to, when you're feeling overwhelmed, there's a lot of rush of hormones. There's a lot of rush of chemicals. I'm not going to get into the medical detail, but basically what they do is they make you feel in a fight or flight response. Like either you want to run away from this forever or you're going to break something. You're going to throw things on the table or, something like that. You'll just break down. So to cut off from that, what you need to do is just simply this simple thing of breathing in and out. At least just do that for 10 seconds. It will definitely help. It distracts you. It helps to lower down your heart rate, which again slows down your fight and flight response. Or alternatively, you can do other things like, counting on your fingers or something like that. If we integrate CBT into it, there's a very effective technique of progressive muscle relaxation, PMR. I talk about it a lot. It's something so simple. Literally, I have tried teaching it to my 12-year-old cousin, and she actually got it. It's something so simple. You don't need a therapist for it. You can just learn it by yourself. This helps every single individual. Okay, anybody who is having an anxiety or panic situation or attack. It also helps children with autism if they're having a meltdown. You can try the same technique with them to calm them down. So I'm going to teach that also in a moment. So this could be your step 3. Okay, you take a deep breath, you cut off from the situation. Number 1, you take a deep breath at least for 10 seconds. Then you move on to PMR, progressive muscle relaxation. Okay, once we are done with the PMR, what will happen is that it will release your muscle tension. You know, when you get anxiety, what happens? First of all, your heart rate increases, you slow it down by breathing. Then there's a muscle tension, your shoulders become up tight, your teeth are clenching, right? All these things happen. The PMR will help to get rid of that. Okay, now we're moving on to step 4. Step 4, now this is something which is a little, how would I say, controversial. Okay, because some people agree with it, some people don't, especially when it comes to professionalism. They think, why you're bringing personal sentiments into it. But I cannot, this is something I have seen from experience, I cannot emphasize enough the importance of your personal belief, such as religion, into this. No matter what religion you belong to, right?
Yeah.
No matter what religion you belong to, or either you're a Christian or a Hindu or a Muslim or a Buddhist, whatever it is, your personal belief helps. It gives you hope. I am a therapist. I talk about medicine. I talk about all of these therapies, strategies, medicine. You cannot remove religion from that. It gives people hope. Just saying a simple prayer, like as Muslims, what we do is we pray some salat or some durood for our prophet. We will say just the name of Allah. That's it. For every person, whatever they believe in, just at this step 4, I want you to focus on your personal belief. Know that you're not alone. Know that there is this force which is going to be there for you as your support system. It really helps. We can't ignore this. Okay. Okay, so I'm not going to get further deeper into this. And on step 5, what you can do is just do something that makes you feel
good.
Now, this can vary for people. You know, some people like things which are longer. For example, they want to go for shopping. So that might take a long time. You might need to have, you know, someone to replace you for a longer time period. But personally, for a person like me, for instance, I like to paint. So, you know, I have my easel and my painting, canvas all the time over there. I don't have to finish it. I just take out the colors and just do it on the board. It helps me to release it. There's something simple like that. For instance, some people like to cook. Just go ahead, make a pancake for yourself. Get an ice cream, order from, you know, wherever. There are so many food delivery services.
Or walk outside.
Yes, definitely.
Helps a lot as well.
Definitely. When I said the first step actually for breathing, it's absolutely much better if you, instead of going into your room, step outside the house. You know, if you can stand in a park or wherever there's some greenery, then you start these steps. That will definitely help you. If you want to ask something, you go ahead with that. Then I will talk about the progressive muscle relaxation technique, and I will teach it to all the people.
I think we just can go on with the PMR, so that later on I'm going to be talking about a little on the medical system. Let's say you pointed out something saying that others don't want to acknowledge that, bringing the belief part. I will talk about it a little later, but yeah, go ahead with the PMR. I'm really interested.
All right, sure. Yeah. Okay, so first of all, PMR, progressive muscle relaxation technique, is something super simple, but you need a place of quietness for this. Okay, you don't want to be having a lot of noise or anything, but definitely you can do it anywhere. And like I said, it could be applied to any individual as long as they understand basic instructions. Okay, so what we're going to do is we are progressively going to relax our muscles from down to up. Okay, so we start by, what we do is we curl our toes. Your feet are like this. What you're going to do is you're going to curl your toes like this. Okay, try to curl them, keep them tight a little bit. Everything we're going to do is for at least 3 to 5 seconds. Depends how much time you have. You curl them. You can all try with me right now. Yes. No, no, no. You just keep them like this.
Okay, okay.
And then after counting for 1, 2, 3, 4, 5, then you release. So what it's going to do is it's going to like pull your muscles and it will relieve it. So at that moment, your feet will start to feel relaxed. Then you do the same thing. What you're going to do is you move up. For this exercise, you can sit down, you can stand, it doesn't matter. Then you're going to do it kind of for your legs. So if you're standing, you can just, move up a little bit. Stand on your toes, move up a little. So your legs will feel stretched. Again, you count for 1, 2, 3, 4, 5. You're not going to do it like up and down. Just stay like that for 5 seconds. Then you release yourself. Next, what we're going to do is we're going to move on to our shoulders. Okay. Yes. So you're going to shrug them up like this. Okay. You're going to shrug your shoulders up. Yeah. Just keep them there for like 1, 2, 3, 4, 5. And then you release. And when you relieve, you will actually feel it. After 5 seconds, like, you'll feel some relaxation here. This is the most important part, so I advise usually, at least for this part, do it a bit longer. You can do it for like maybe, let's say, 10 seconds. The longer, the better. Then you move onto your arms. You bring them forward in front of you. You see, like this. So your fists are in front of you. Okay? Yes, exactly like that. Correct. Perfect. So you do like this, and you pull your arms like as if someone is pulling you forward. Okay?
Oh,
pull them
get
forward.
It. Like
yeah.
pushing the hands forward a lot like that,
correct,
right?
Correct. Correct. Exactly. Yes. So it will feel like someone is, pulling your arms. So as if you're pushing something, you try to do that, and your fist should stay clenched like this. Okay? Again, do it for 5 seconds. Then you relax them. Then you just relieve them. Move them down. Shrug them. Okay, then you're going to do the same for your hand. Now, for hands, you can do it like any way you want, either at the front at the same time or down. Okay, so you just punch them even tighter. Now, as if you're holding something very strongly, okay, you don't want to let it go. Just very strongly, you're holding it. You will feel this pressure in your hands. Again, after 5 seconds, and then you can shrug. And lastly, you're going to do that for your face as well. Now, this one I do not advise to everybody, but if you want to do it, it's great. You do it for your muscles of your mouth as well, because mouth, we clench it a lot when we're anxious, So what you can do is you can just puff it up. You can puff up your mouth. Keep it like that. 10 seconds, 5 seconds, going. Yeah, something so simple. So in total, all of this will take like a minute at max. And after a minute, you will feel all this tension here, in your cheek, everything, it will be gone.
Yeah.
So what we are doing is we're giving physical relaxation first, so that our hormones and our, all the anxiety chemicals in our body, they will come down. And then we will move on to, doing something nice to make you feel more relaxed, praying or whatever that helps you. So yeah, it's something so simple. You can not only do it for yourself, you can also do it for if your child is having a meltdown and they understand basic instruction and they follow instruction. You can ask them to sit down and make them do the same thing. It helps a lot with anxiety in children who have autism or adults.
Okay, so now a little explosive question, okay? So the thing is, our community is basically divided into 2 sections. One section says that it's a disease and we have to cure it, or we have to totally change the child, blah, blah, blah. Doesn't work. Okay. There is another group who thinks that there is nothing much to be done. It's acceptance that my child has autism. He can't speak. He needs help. Okay. What I can do is, if he can't sleep, I go to the doctor. He gives some sleep medication. I give it to him. I try. He's breaking things. I'm crying. I'm blah blah blah. I, on the other hand, I want to take an approach which sometimes comes as controversial, okay? So the thing is, I believe myself that obviously this is a brain system, like a programming. It's a lot like Android and, Apple. So there is no point asking an Apple to become an Android and the Android to become an Apple. No need even. We have to learn to, explore the Android or the Apple, understand it and give it all the support it needs to be bug-free. If my child cannot speak, it's a bug. I cannot just accept that my child is okay, he will be nonverbal, because it affects his quality of life, it affects our whole family, and it affects his future as well. And as a parent, I cannot just sit and then just sit like that. Okay, so I am always in a point that I want to help my child and help the other kids become the best version of themselves and help their brain develop. So brain development is possible, definitely, right?
Yeah.
So even if my child is nonverbal now, if the child gets the proper support, the brain will be able to accomplish and recover whatever word you want to use, the developmental delays. It's not about recovering autism, it's about recovering developmental delays, right? Okay. Yeah. So my question is, why does our beloved medical system doesn't want to see a human body, a human brain, a human baby as a system, rather than just like, you know, a symptom that has to be treated? Like, my son is not sleeping because there is a reason for that. A lot of reasons for that. So rather than trying to solve the root case, why do we have this tendency on putting on band-aids and being kind of robots? Why do we do it?
Right.
It's my question. You can answer it or you can just let it go, but I would really love to have this answer.
Yes, absolutely. I'd be happy to answer, actually. And this is not the first time I've heard it. In fact, this afternoon, there was a father who talked to me about it, and he said that, you know, we're so afraid to go anywhere else now because they come from a different country, and I'm currently at a different place. So they were like, you know, you're not there. We don't want to go to any other place. Can we try to do the session online, something like that? And they were saying that basically we are so afraid that people are just going to continue what they were doing before. Now, what they were doing, same thing, symptomatic treatment, we call it. So you're just, whatever is the symptom, they're fixing it and then go.
Yeah.
The reason for that is the parents, actually. I have this trouble to make people, especially the parents, understand that no miracle is going to happen in a day. This is what happens in symptomatic treatment. Let's say there's a therapist X, okay? You take your child there. What she is going to do is she will fix all the symptoms initially. Okay, she will just put the band-aids, like you said. You see, oh, the blood stopped. She's the perfect therapist because she gave me XYZ medicine. It's perfect. My child is improving in a day. I can see it. I'm only taking my child to that. On the other hand, what happens is if you bring your child, let's say to me, okay, and I will start like a gradual therapy. I will take, which is the actual protocol of 14 days, even before I give you an assessment. What will you think as a mother? You will be like, she doesn't even know what she's doing, I think. It's been 2 weeks. She hasn't even given me a diagnosis. When is my child going to get better? So this thing that parents actually do, and in the end what they do is they remove the child from that facility. And it works not only for autism, the same thing happens with all kinds of medicinal problems, because I'm a medical doctor too. When I was working at the hospital, at the clinic, patients would love to go to a doctor who will give them 5 medicines, okay, which have so many side effects, but it will make them fix like this in 2 days. But the problem stays in their body forever. On the other hand, if I recommend them, okay, I want you to do test A, test B, test C, test D, until I figure out what is actually wrong, then I will give you a medicine. I will not give you medicine before that. They're like, I'm in pain. What is she doing? I'm not doing to her. So this is the problem, that it's actually arising because of this consumer and manufacturer, or let's say like because of this commercial mindset we have. Because the parents want immediate results. So
I could hug you right now, you know. Keep going. Too good.
Thank you. So I think I'm glad that you can relate and understand where I'm coming from. Everything I'm speaking is coming directly from experience. And you learn these things eventually when, parents keep complaining. So the first day they come, the first thing, even today when we started, I keep insisting on it. Don't expect miracles to happen in a day if you want substantial results to last. He wants something substantial. If you want the root cause to be found, we need time to get to the root. We need proper, therapy for it. You can't fix it like this. You want quick solution, you will get that, but it won't help you in the long run.
Then
So, yeah.
they usually, if I talk to someone, let's say I'm talking to a mom and saying that, okay, your child is not sleeping, so you went to the doctor and then they gave you the pill and you gave it, you know that this is a sleeping pill, right? She was like, yeah, you know. And then I was like, even if you are not a pharmacist, we all know that modern medicine has side effects, and anything that works on the brain affects the brain. So why didn't you try to find another way? So she would answer in a way that I don't know, because it's the duty of, first of all, the duty of the government to give us funds. It's the duty of the doctors to tell me what's going on with my child. It's the duty of the therapist to show me the way for my son to bring out the speech and everything. So a lot of the time,
guidance.
Exactly, guidance. And I myself am I'm coming openly and saying this, like, I am guilty as for that as well, because for the longest time I was actually waiting for someone to save me. I was waiting for the doctors to tell me what to do with my son. I was waiting for someone else to tell me what to do, and I was just stuck because of the belief system that you have talked about. And what we in Autism Success Academy, we teach now very in depth, because I believed that motherhood is struggle. It's supposed to be exhausting. I'm supposed to be the martyr. I'm supposed to be, the Mother India, Mother Pakistan, Mother Bangladesh kind of category. Okay, so I have to fit in a mold. And the more the more I am struggling, I'm wearing that as a medal of honor to show to others how worthy I am. I'm not sure if my moms here would agree with that or not, but I think deep down somewhere we have this notion of being a martyr, which sometimes actually creates more problem in us. Okay, do we have a question here? Ma'am, please मुझे स्कूल के बारे में बताएं जो लाहौर में है. So you have a school in Lahore?
No, actually, I don't have it myself. Ms. Darlena, you can DM me. I will guide you. So what I do at NARCP, I'm going to talk a little bit briefly about it as well. So National Autism Resource Center of Pakistan. This is an initiative I just recently started when I came to Pakistan and I visited what are the problems the mothers are facing. So what we do is, besides providing support to the mothers, I also connect the therapists, schools, inclusive schools, therapists, inclusive schools, whatever facilities they're looking for with the parents. I'm doing it completely free of charge. I'm not charging anything. So I just ask, if anyone wants to know, where can they go, in which city? Because the problem is in Pakistan, unfortunately, we don't have a list currently of autism schools, inclusive schools, list of therapists at the moment. So parents are confused, where should they go? So at NARCP, we have registered specialists, speech pathologists, therapists, ABA therapists, everyone, and we connect them with the parents. So I think that's why perhaps they're asking.
And Elena also said that you can go to Autism Resource Group Pakistan. She also has a big group, I'm sure about it. It's called Super Moms, right, Elena? She has a group called Super Moms. Autism Super Moms. So you guys can go over there and check her out as well. She has a lot of resources. I am really, really so much, happy to see you guys coming forward and trying to build. And I think I should do something like that for Bangladesh as well. Yeah, coming to think of it, that would be really great as well. So tell me one thing. Yeah, definitely. So you said you're going to be mentioning a lot of resources. So since we are already talking about the resources, why not share a lot, whatever you want to share with us?
Right. Okay. First of all, so which resources are you particularly referring to right now? For mothers or for
both,
for their parents, children?
As well as child? Yeah, for both.
Right. Okay. So first of all, the most important and the most easiest, which many people are not familiar with, is the Autism Speak website. If you go to Autism Speaks website, you will find tons of free resources there. As a therapist, you can find, as a parent, you can find, as an autistic individual for yourself, you can find. And they're all free of charge. They're downloadable, printable worksheets. It's the easiest thing to do. And you don't need like any special guidance for that. You can just download them and read them. They're available in PDF forms. So yeah, that's one thing which is very helpful. And the good thing is all those resources are reliable. Like I said, unfortunately, here's something I want to talk about, Krishnava, that you just mentioned that, I really appreciate a lot of you people are coming up and doing something about it, which I also felt really good about initially when I came. But unfortunately, at the same time, it's really sad that many people have made it like a business and they do not even have the expertise to do it. I was shocked to go to autism centers, which are apparently quite famous here, and they're saying, we have experts and specialists who will make your child perfectly fine, as if autism is a disease and it can be cured. And when I went there and I asked about their qualifications and everything, they're not qualified for it.
Okay.
They are mothers who set up like a center in the drawing room of their home, and they do not hire any therapists. And how they're doing it, they're watching YouTube videos. That's how they're treating someone's child. They're slapping them. Can you believe it? When the child does not respond, as a reinforcement, they're using physical violence. They're slapping their children to reinforce the behavior. So this is why it's also very important whenever you go to a therapist, or whenever someone is referring you to someone, you make sure that they're qualified to do it. Okay, there is no harm in doing that. So yeah, that's one thing I wanted to talk about. So Autism Speaks is one of the resources where you can actually find the information, which is reliable and completely free of charge. Okay, besides that, yes, there are some YouTube channels as well, which can guide you a little bit about, how you can manage your child at home, right? So there are some tips for there you can use. Again, this is not compared to a therapist. It cannot replace a therapist, but again, there are helpful tips which you can use at home. Okay, secondly, this should be the first thing that we talk about, the autism diagnosis journey of the parents. So many people, they would directly assume, I think my child is having some symptoms of autism. And they will directly go to an autism specialist or a speech therapist or a behavior therapist without going through the proper channel of diagnosis. I really want to talk about this. This is so crucial and important. So now you see, you went to someone, they need a client. They want to make money. Even if their intentions are good, I'm not denying that. Maybe they are doing a good job, but they also need a client, right? They need to pay their bills. So they immediately start working on the autism side. And what happens is, this actually happened to one of the child I was talking about, who was diagnosed as autism before. And later on, when I checked, what happened was he had a problem with the muscles of his tongue. They were saying he has speech delay. And so what I actually checked was that he had a problem with his tongue. The muscles of his tongue were weak, so he was not able to speak properly. And that related to all the behaviors that he was having, because he had speech delay. He couldn't communicate properly.
He would be he would be irritated.
Yes, he would be irritated. He will get aggressive. He will have saliva coming from his mouth. Children will not become friends with him. All of the things were happening because of his tongue. And they diagnosed with him autism, and they started the therapies and everything. Nobody even once checked what is medically wrong. So it is very, very crucial you go through the proper channel. First of all, go to a pediatrician. You go to an otolaryngologist. They will check the ear, the nose, the throat. Okay, if there is anything wrong in these three areas, does the child have any auditory issues, right? So these things are actually often neglected. So you must make sure these things are okay. You need to go to a speech pathologist. A speech pathologist will check, what is the reason for the speech delay. So Then besides that, you can also go to, a neurologist. Okay, they can check what if there is something that affected the brain directly. For instance, many cases of the children that come, they had like a disease or something when they were younger, okay, which
Yeah.
affected their brain. So, yeah. So I'm not going to again get into the medical details of it, but basically what it does is it affects your brain in a way which could be actually treated. Okay, then there are other things related to it, such as epilepsy. There was a child I met who had tumor at the age of 10. So all of these things you need to rule out. You can't just directly jump to, oh, I think my child is not looking and behaving normally. You know, I've heard that actually. This is how I've heard. And the mother would say, oh, I thought he had autism. So you need to go through a proper channel. Then only they will recommend you to a psychiatrist or a medical, medical professional.
Yeah, that's so nice.
That's great.
That's the
yeah,
right
exactly.
thing to do.
That's the right process of diagnosis, okay? And once they refer you, okay, now I think you should go to a child psychologist. There is something which is psychological, not just physiological or pathological. Okay?
So the summary
so
of that is we need to find out the exact causes why something is happening and to be really authentic with the diagnosis and go to the right experts, at least to get the diagnosis first, and then with the options and everything. So another question is
exactly like what you said previously. It's again treating the symptoms. You're not finding what is the reason behind it. Imagine that child, he had been going to an autism center for therapies for the last 5 years. And the only problem was the muscles of his hand. Can you imagine his psychological health, how it must be affected? So this is really crucial to have the correct diagnosis. And like also previously we were talking about it, if a child behaves in a certain way, there's a reason for every behavior.
Yeah.
They want something, there's something going on at the end, at the background. It's not just happening out of, no reason for it.
Oh, yeah, you're right, Elena. Okay, I have another question. So a lot of moms come to us and then shares that, and it was also my experience as well, that the therapies that we are taking to our kids are not really working that well. For example, the speech, when I'm going to the speech therapies, even if I have gone there for months, maybe 1 or 2 years, some of them have been there for 5 or 7 or even 8, 9 years, and then the speech is not coming. Or maybe occupationally, the only thing that the child can do is maybe hold a fork and then self-feed. So for those situations, what do you think is actually going on with the child?
There is a very famous quote that I just thought of when you were saying this. It goes like, if you have met one child with autism, you have only met with one child with autism. There is no one rule applies to all. I'm sorry, I'm not sure about the reference, but anyway.
Okay.
So this I find is very authentic. Every single child with autism is different. It's not, I keep talking about this again and again, autism is not a disease, it's a disorder. In a disease, what happens is, okay, let's say I have a disease in which I am allergic to lactose. Okay, I have lactose intolerance. So what you do is, you remove the lactose from my diet, I'll be fine. If let's say I have allergies with pollen, you remove the pollen, I'm okay. Diseases work like that. In a disorder, we are not really sure what's actually going on, but this is something which is not in the order that generally it's supposed to be. Okay, okay, so what I was saying is that I got a little distracted here while I was saying.
It's okay, yes. Just keep saying.
Yes, I was saying that you can't apply one rule to all here. So this is why, as you mentioned, that one child is having therapy and they achieve their goal and milestone in 2 years, and the other one is not achieving the same in 7 years. There's another reason for this. I really want to talk about it. I actually made some notes especially for this to give you some parenting tips, in which it's very essential to figure out the goals. Now, many therapists don't guide this, but whenever a mother would come or a father or whoever is the autism parent would come to me, I always guide them that before we start the therapy, I want you to figure out what are the goals that you want for your child. you establish the goals, then we work on it, it becomes so much easier. You just bring a child, you give it to the therapist, and you say, fix it. Not how it works. You need to have
There is a problem.
proper
Fix
communication. Yes, this is not really how it works, right?
Exactly.
What you need to do is, you need to figure out before you go to the therapist. First of all, make a list. Okay, my child has these strengths and these things which are really deep. We need to work on it. These two things we have them there. Then you want, okay, these are the goals I want for my child to achieve. Your therapist should then analyze, after doing the assessment of your child, they will give you a time period, an estimated time period. Okay, we as therapists establish SMART goals, SMART. That's an acronym. Okay, and one of the things in that one is it should be achievable. So they give you an achievable goal that, let's say, okay, for this goal, let's say you want your child to point towards something. I think based on the current assessment of your child, he can do it in 6 months. Okay, but now let's say there is a child that comes who has mild autism. And on the other hand, there's a child who comes, the spectrum is like in different levels, right? There is mild, moderate, and severe. Let's say a child comes who has severe autism. He might also have ADHD with it. He might also have anxiety issues. He might also have a speech delay. He might have so many things. You can't say the same goal for him that he will achieve in 6 months. So you need to understand, don't compare your child with others. Your child have your own diagnosis. They have their own. And also another factor is the age. At which age did you get the intervention? Early intervention is so important. So if you're comparing your child, yes, who you're taking to the therapist at age of 5, and there is a mother who took their child at the age of 2, do you think the therapy will go at the same level and at the same time? It won't. So that's another thing. Yeah.
Exactly. Okay. So apart from that, is there a question? Some people don't even know their child have autism. They just think their kids are stubborn. Parents can't accept their child could have a disorder. Exactly. The other day, there was a mom DMing me that, sisters, help me. I'm crying my eyes out. I can't accept. So I was like, even I couldn't accept that my son had autism, because to me, it was like a permanent seal that my son is broken. And yes, if I allowed that, if I didn't intervene, then he would have been having a broken stuff and whatnot. But he was severely nonverbal. He had self-harming, a lot of other stuff. Okay. So we have been able to turn most of the stuff around just by changing a lot of the stuff at home, how we communicate with him, how we feed him. Because I truly believe, and I have seen a lot of people as well, a lot of research saying that developmental delays and other things affects, the brain. And then we can definitely help the brain rejuvenate, and how to say, like, flourish and things like that by the proper nutrition as well. So we're not saying like only nutrition will do everything. We are saying that a lot of stuff has to come together because your child has special needs.
Depending on their needs.
Exactly. Yes. He's not like a typical 5-year-old, 3-year-old that the typical 5 or 6 things are okay for him. For this child, you will need a special stuff, and you have to have that, thing inside of you to be able to give those things to the person as well, to the child. Okay. So as I think we have been here for quite a long time, I want you to wrap this up for us in a nice way and leave us with a note of positivity that even if my child has whatever stage he is in or she is in, that there is hope, and then we can do stuff for them by first taking care of ourselves, and then also finding out the exact reason why something is happening to my child, and then going forward solving those problems, right? What would you say as a summary to us, to our students here?
Okay, I'm going to talk in 2 different ways. First, I'm going to talk about as a mother, how you should focus on your child. Okay, and then I will talk about what you can do as a parent yourself and for yourself. So first, I mean, there's so much we can talk about. If I start giving tips, what you can do this, do that, it's in 10 hours. But
you were okay with that.
Absolutely, I'd be happy to. It's been actually a very nice interaction today. But anyway, so, as I was saying, there could be so many things, but there's this most crucial thing that I always want to emphasize, and I always tell mothers and parents about it. If your child has speech delay, which is the most common thing that parents complain about, don't think your child is not communicating. I want you to remember all sorts of communication is communication. Holding your hands firmly, this is communication. Your child stops doing something, this is communication. He puts his toys in the correct place, he's following his schedule. All of this is communication. He is echolalia. Echolalia is so common, which is like, your child keeps repeating something. Let's say a child heard like, let's say, good girl. Okay? So whenever they do something, they know that you said good girl, they start doing it. I did something nice, they will say, good girl, good girl, good girl. They're communicating that they understand what you're saying. So I want you to not be disheartened, okay? If your child is not communicating in the way you want, you need to look at the world from their perspective. Why we are always focusing, I am such an advocate of building a society around autism instead of, focusing only on fixing the individual themselves. There's no need for fixing there. As you said, there's always room for improvement, right?
Yeah.
And we should definitely work on that. We all should work on ourselves for our children to improve.
Yeah.
But I also want you to not be disheartened. Okay? They're communicating in their own ways. I want you to focus on that, appreciate that, praise them for it. They do this, you praise them. They're communicating with you. They point out on something. They're pointing to a picture. They're communicating. Okay, so don't be disheartened with that. Take those little milestones and develop them further. Okay, if they're doing this today, next time you praise them, give an incentive, raise it to something else, raise it to gaze. It works like that. Okay, there's step by step. Do not give up. Your child is unique. Your child is different from others. We are all unique. Okay, if people lack the capacity to understand that, it's their problem. You don't have to feel scared or ashamed. Parenting is not an easy thing for any kind of child. But also it can be easier if you're kinder to yourself. Okay? You don't have to be so harsh on yourself. You're doing your best. It's all right. What you need to do is you also need to take care of your psychological health. Doing simple things like just praying a little, spending some time with yourself, half an hour, 15 minutes, 10 minutes that you can take out to do some exercise, do your breathing technique. It's all okay. So first, communication. Second thing, taking care of yourself too. One more thing is, this is a little, I would say, not every parent do it consciously, subconsciously it happens, which is autism. Having a child with autism is not about you. Okay, parents tend to make this about themselves.
Yeah.
It's all about me. It happens naturally, Dr. Krishnava, it happens. It's not like we do it on purpose, but mothers often come to me and they're like, it's all my fault. I'm not a good mother. I am this, I am that. This is not
even
about
the other
you.
people, the husbands, the in-laws, and even her own parents also say, like, I wasn't a mother like you. You did something wrong. That's why your son is autistic. How rude is that?
So it's absolutely insensitive. So like I said, this is not about you. This is about another life, another being. Try to look at things from their perspective. Okay? How they're feeling, what they're trying to communicate. And at the same time, this is not on you. Okay? If someone gets fever, if your child gets fever, do you blame yourself? You don't. It's natural. It happens. So stop making it about yourself. Try, whenever your thoughts go into that direction, redirect your thoughts. Okay? You can do that. This is why CBT helps. CBT, actually, cognitive behavioral therapy, this helps to bring your cognition, your thoughts, and your behavior, which occurs as a result of your thoughts. It helps to redirect. Okay?
Exactly.
Yes, don't compare yourself, your child to other people. Okay? be empathetic to each other, try to find your support group. What I do is actually I have two groups on Facebook and on WhatsApp for all the mothers, and there are groups for therapists too. So anyone who's interested, they can DM me. I can add. I can ask my assistant or myself to
I'll
add you
put
in
your
both the
links
groups.
in the description of this post, inshallah. Okay.
Perfect.
Because
Perfect.
I wasn't sure whether I could share your WhatsApp number or not. Is that the same WhatsApp
Absolutely,
number?
please do that.
Okay.
Yes, that's the one. That's the official number for NARCP. So
Okay.
whoever wants, what happens is in those groups, all the mothers, they communicate with each other. They're
Mhm.
telling each other every day. See, this is also, I know it's getting a bit longer, but I really want to talk about this. Mothers often come to me, they say, I'm meeting my friends. I've stopped meeting my friends. I've stopped meeting my sisters, my brother, because what happens is all of them, they're talking about their typically developing child and their milestones. And I feel sad because I can't help but compare my child to them. That their child today went to school, they did a singing performance, they did this performance, my child couldn't say my name. So that makes them into this inferiority complex kind of thing. This is why it's important to have your own community where all the autism moms come together. They become friends, they talk, okay, these are the milestones which are achievable for our kids. And they feel more like they're not alone. So if you want, I can add you to that group. All the mothers, they communicate with each other there as well. And if anyone has a question directly for me, because of my busy schedule, I'm not able to respond immediately. But within a day or two, I always, respond to the question.
Mashallah.
So, yeah.
Everyone go follow her for all of this awesome, expert advice that she has been dishing out. And inshallah, we will try to bring her back again. We have pretty much gone off, off the charts with our today's topic. I have loved and enjoyed every single, moment of this one. And inshallah, thank you every single one for all the loves and the questions and the stuff that you have poured in. This, is all about giving you hope that this is not the end of the world. Your child has the potential. If anybody is saying or making you feel like your child's potential is just gone, it's totally not true. Obviously, yes, you cannot or should not compare your child's potential with somebody not on the spectrum or maybe some other age, but you have to have practical yet sustainable faith in yourself and your child, because faith moves mountains. Okay, so thank you everyone. Thank you for being with us, Dr. Hira. It was lovely to see you. Okay, I'll see you in another one, and also my favorite ladies here. Okay, love you all.
Thank you everyone for joining. Thank you, Dr. Faith. Bye-bye.
Bye.